National Eating Disorder Awareness Week, and we here at Daytime Buffalo want you to know that there are resources available if you or someone you know is in need. I talked to the Western New York Comprehensive Care Center for Eating Disorders to learn more and spread awareness. Take a look. Welcome, Mary Tantillo from Western New York Comprehensive Care Center for Eating Disorders. For those who don't know, February 26th through March 3rd is National Eating Disorder Awareness Week. So, Mary, we wanted to talk to you as an expert to give us a general idea of how common eating disorders actually are and who are typically impacted by them.
So I'll use New York State as an example. Up to 9% of New Yorkers at some point in their lifetime will have an eating disorder, which is over 1.7 million of us in just this state alone. When you compare eating disorders to something like depression, the prevalence is lower. Like depression is more like 1 in 4 or 5 people. Anorexia nervosa is closer to 1% of the population or a little bit less. Bulimia nervosa, maybe 1 to 2%. But with eating disorders, it's more common than we think, but it's the magnitude of the problem when it does happen. So they're lethal. They're the most lethal psychiatric illness outside of opioid dependence. And your question about who is at risk, well, all of us. There's a lot of myths about eating disorders. People used to think, and some still think, unfortunately, that they only happen to skinny, financially well-off white girls. Not true. You can be of any race, ethnicity, any socioeconomic status, any body size or shape, any gender identity, any sexual orientation. The eating disorder does not discriminate. Any of us could be at risk.
If someone is struggling, let's talk about your center and the resources you offer for those who are struggling.
So there's a couple different resources I want to talk about. The Western New York Comprehensive Care Center for Eating Disorders is a partnership between the University of Rochester School of Nursing, the Golisano Children's Hospital at University of Rochester Medical Center, and our community affiliate is the Healing Connection. And what the centers do is ensure that New York residents have access to care, all levels of care, and we provide the services based on wonderful tax dollars that are not reimbursed by insurance. So, for example, parent-peer mentoring, life coaching, care management, education, outreach, information, and referral. We do all of that. And then places like the Children's Hospital and the Healing Connection provide direct care.
Can you talk a little bit more about the idea of being sick enough for treatment and the stigma that's around that?
There's actually a book called Sick Enough by Jennifer Gaudiani, who's a physician. There's still a lot of stigma, unfortunately, attached to eating disorders. Something about having an eating disorder that has a lot of secrecy, blame, and shame, and denial surrounding it. So, for example, when I'm interviewing somebody who has an eating disorder, they will even tell me about their trauma history before they tell me about their eating disorder.
What are some common misconceptions about eating disorders?
Common misconceptions are that, again, eating disorders only happen to women and girls. Not true. They happen to boys and to men. And it's important to note that boys and men have a little bit of a different sets of concerns. Women and girls are often preoccupied with the number on the scale and thinness, whereas guys tend to be more preoccupied with muscularity. So that's one. Another misconception is if you're an athlete, for example, and you turn up in the doctor's office and they find out that your pulse is really low, they'll think, well, that person's an athlete, so that's okay. That's not necessarily true. That person could have low pulse rate because they're restricting food. Lots of misconceptions about eating disorders happening, again, like I said, to only white girls and women. Not true. African American and Latino women suffer, and they suffer a lot because they often aren't even identified early because people aren't thinking properly about who is at risk. Like I said, that could be any of us, regardless of ethnicity or race. So those are some misconceptions, including the misconception that once you have an eating disorder, you'll never recover. Recover is definitely possible. And really what it comes down to is identifying these illnesses early. The earlier we can identify and the earlier we can be aggressive with intervention, the better.
Mary, what advice do you have for anyone who may be struggling or for someone who knows someone who could be struggling with an eating disorder?
Talk to the person. Pick a private spot because nobody likes being talked to in front of a group of people. And when you start the conversation, invite the person in a conversation by telling them you love them or you care about them. and that you've noticed some things and you're wondering if you could just talk for a few minutes about what you observed and use I statements, not you statements. Like, I feel worried because I've noticed that every time when we finish dinner, you get up and you go into the bathroom and I've walked by and I've heard what sounds like vomiting. Even if you're wrong, you can say, I might be wrong, but here's resources. If it's an adolescent, I tell the kids, tell an adult. Don't let your friends tell you keep a secret, because that can make a difference between long-term illness and nipping it in the bud, right? Silence is what kills people, because eating disorders isolate. And then if you add that with the silence of not reporting when you see one, you can understand why people can go on to have chronic illness or even die earlier than they're supposed to.
Mary, thank you so much for coming on and sharing more of this important topic to discuss. And like she said, if anyone watching is struggling or knows someone who struggles with an eating disorder, we have all of those resources listed on our website.